During a pandemic crisis like that, for many different reasons, it's really normal for us to feel sad, insecure, worried, anxious, and angry. And social isolation can make it even worse, especially if you think that it may take longer. There is certainly no one size fits all approach to managing our emotions during these outbreaks, and each person is most likely to know their own ways to de stress, using strategies that have been effective in dealing with other past difficult situations. Even though the general recommendations are, interestingly, the same as those that we usually have difficulty into incorporating to our daily lives, even in much less turbulent times. Now we have an opportunity to rethink the way we're dealing with it and reconnect.
Through recommendations of what's referred to as self-care. And self-care, it's not a bad idea, but I think it's an especially Western idea, where in other cultures, other parts of the world, we might be thinking about, are there ways that we can take care of each other? And here the preoccupation is with, how do I take care of myself? And that can be a pretty lonely prospect. And so then what we run into, or what I run into in my practice, and I have a training clinic here as well, what the counselors run into is people who sit in the client seat who then are complaining that they're failing at adequately practicing self-care. And I think that failure comes less from an experience of their inadequacy and more as an effect of the limitations of a concept like self-care, and that it really is in relationships that we thrive. It really is in being kind of seen and known to others, witnessed, loved, and living in connection that are contexts where it's more possible to thrive, or in an experience like we're all going through now, simply to survive.
You have often heard from people to connect, but in my discussions with my clients, we have found it's not only about connection, it's deepening the connection with your loved ones, especially trying to find moments when they are doing something good and you catch them in that moment and you appreciate them. Because our mind is tuned towards negativity, we can spot, analyze, and criticize things very quickly. It takes a little bit more effort to pay compliments. Perhaps this is a time to pay compliments even to your loved one. Also, this is a time for restoration of relationship.
It's really essential. If one must stay home, keeping a healthy lifestyle and kind of a structured routine is very important, and that refers especially to eating, sleeping, and exercising. Healthy activities that we enjoy and we find relaxing are also very helpful, but in contrast, using tobacco, alcohol, and other drugs in order to cope with these difficult emotions is certainly not a safe choice.
Decide what amount of information is very important for you, because you don't want to avoid information, but also you don't want to obsess about information. And this is the time you want to start thinking that perhaps the book that you wanted to read you haven't read, the recipe that you wanted to make or try, or the mindfulness practice that you always wanted to do you haven't done. So these are the times to start those things, at least give it a start. Finally, someday this will be over. And my hope is, before we move into this new normal, perhaps this is the time for you to reflect what kind of person you want to be in 6 months' time. Maybe a more centered, more reflective, more connected person. And what specific changes you would like to start making today in order to be that person?